It is really my great privilege, and I'm excited to have Dr. Michelle Bowden present for us today, virtually from all the way across the state. As I was talking to her a few minutes before we got started, if there's one positive thing out of COVID, I've really been excited to be able to bring speakers from all over to our Grand Round series. Ordinarily, she would have had to drive 11 hours to come to our Grand Rounds, but here we have her here with us today. Dr. Bowden, after an undergrad at Samford University, has done her medical schooling, following which her residency and also her adolescent medicine training from University of Tennessee in Memphis. Since 2017, she has been practicing general pediatrics at UT Le Bonheur, along with her adolescent role there, and also has been the general pediatrician for youth villages in Memphis. Recently, she has won the AAP designation as their e-cigarette champion for the Tennessee AAP, which is, I think, a very well-deserved role. And you all will agree with me after listening to her talk today. I've had the pleasure of listening to Dr. Bowden actually a couple of times already this fall. And when I heard her talk, I was like, oh, we must have Dr. Bowden come talk to us for our Grand Rounds. She has several publications to her name, lots and lots of presentations, and is also on several grants and is very well equipped to give us this talk on the vaping epidemic. Without further ado, Dr. Bowden.
Thank you so much. I am delighted to be here, and I really appreciate the invitation and getting to continue to share what I have learned in recent years about vaping and what we as pediatricians can do to help our adolescents really survive this uncharted territory that most of us didn't have to deal with as adolescents, but our adolescents that we are bringing up now certainly will have to deal with. And so I feel very grateful to be able to have these conversations with you all. And grateful to be with you today. So we'll start off just with this disclosure statement that none of us have anything to disclose, and we're certainly not making any money by warning you about vaping. So here goes with the rest of it. So our objectives today are that we're going to start off just defining vaping and vaping products, just in case you may not be familiar with all that exists out there. We'll talk about what vaping is and what the products look like. We'll also characterize the vaping epidemic, which you've probably heard about even in news media in the recent years, but certainly within the literature in adolescent medicine and in pediatrics, and even with adults. And most recently with the COVID outbreak, we have seen more discussion about vaping because it does seem to have some impact on who gets COVID and how severely they're affected by it. We're going to talk about some vaping legislation, especially as it relates to the AAP on a national and local level. And then we'll discuss some general health effects of vaping so that we are well equipped in order to tell our patients about why vaping isn't a great idea for them to partake in, and what are the actual effects that it could have on their bodies as they are a developing and very unique population that we are getting to take care of. We'll also identify some of the effects of vaping on COVID-19 risk and outcomes, as I mentioned earlier. And then I'm going to give you a few tools to take with you in your back pocket, some screening tools and some intervention tools that you can use as you encounter adolescents who are vaping or who may be considering vaping. What can we as pediatricians do about it? So let's just start with the very basics. What is vaping? And by simplest definition, it's the inhalation of an aerosol that's created by heating a liquid that usually contains nicotine flavoring and other chemicals. And if you look at this particular diagram, I actually stole this from a vaping website that was trying to promote vaping. So I'll give full disclosure there. But this is the anatomy of a vape pen. And so if you start here at the back, there's going to be a battery, which in the smaller versions that we're going to talk about, such as Juul, is going to be a lithium battery that's rechargeable. There's going to be a button that actually activates the battery, so it controls your on-off function. And then the battery is going to be connected to an atomizer that's going to be a heating element that generates the heat for vaporization of the actual liquid or semi-solid substance. And then there's going to be a tank and a chamber that can contain either, here it's showing that it contains cannabis, but it could also contain a nicotine-containing substance, a flavored substance that's directly attached to the mouthpiece. And so when you turn this device on, the atomizer will heat. That will then heat the semi-solid or liquid substance that's here, and it will become an aerosolized puff, essentially, that you'll be able to inhale. So what are these devices? What do they look like, and what have they looked like over the years? Because if you were familiar with vaping when it first became popular years and years ago, you may have been more familiar with one of these devices on the left, that there were these big box containers that held your substance that you were going to vape. Some of them looked more like traditional cigarettes or even cigars. There were pipe devices that were actually vaping devices, and then some that are a little more discreet, but still don't look like pretty much anything else that you would carry in your purse or in your back pocket. And really, in recent years, this has all changed, because these devices on the right are what you're going to see your teenagers using now. So these are devices that are very small. They look like USB drives in a lot of circumstances. They may be colorful. You can personalize them. This is essentially the equivalent to a cell phone case. You can choose whatever color, whatever shape, whatever design you want on them, and can really make them very appealing to you, or to, in this case, the products are really appealing to adolescents. And you can hide them anywhere. You can put them in a purse, you can put them in a backpack, you can put them in your back pocket. And really, when I first became interested in vaping, it was an experience that I had with an adolescent who was, I was as a resident with another provider. And as the patient was standing up, as an adolescent boy, as he was standing up, this vape device fell out of his pocket. And he said, "Oh, that's just my USB. Yeah, I just need it for school." And this very astute provider that I was working with said, "I know what that is. That's not a USB. That's your vape pen. What are you doing vaping?" And so they were able to then have a conversation about vaping and the risk of vaping. But if that provider hadn't been familiar with these devices, then he certainly could have believed, as many parents do, that was just a USB drive or something that I need for school, or perhaps they never would have seen it at all. So once you have the vape device, you're then going to need the vape juice or the vape pods. So these are going to be the liquid or semi-solid substances that become aerosolized when they're in an e-cigarette. And the problem with these is that they contain many, many different types of substances, most of which in the United States are going to contain nicotine, but they also contain things like ultrafine particles that can be inhaled all the way into the deep surfaces of the lung. They may contain flavorings such as diacetyl, which has some known harmful effects within the lungs. They can contain volatile organic compounds, and they can contain heavy metals such as nickel, tin, lead. And then, of course, we've all heard about vaping devices that also contain THC that patients can use in the exact same ways they're going to use nicotine devices, but for different effects. So what's important to know that's different about vaping devices than about traditional cigarettes is that when vaping devices were developed, the main goal of developing these, the nicotine within a vaping device, was to make it more palatable. And so they took what was in the nicotine that's in a combustible traditional cigarette, and they made it more acidic. And in making it more acidic, you actually made these nicotine containing substances much more palatable to the general user. So it's easier on the throat. It's easier on in terms of like coughing and like immediate irritation in the lungs. And what that allows is for a person who is ingesting the substance or who is inhaling the substance to get much higher levels of nicotine, because there's no irritation factor, or very little irritation factor as compared to combustible cigarettes. And what develops from that is that you then get more frequent use and much higher likelihood of addiction. Because if there's no bad immediate side effects that you recognize, like I'm not coughing, my throat's not irritated, it's really comfortable for me to inhale this aerosolized liquid, then of course it makes it easier for me to use it more frequently. And as we know, and we're going to discuss with the adolescent brain, the easier that it is to use, the more frequently we use it. And the more frequently we use it in a developing adolescent brain, the much more likely they are to become addicted to it. So in the development of these devices, why did this become such a teen problem? What happened, and how did people really start targeting teenagers, and in what ways was this appealing to teens from the beginning? Well, really, if you look at the history of vaping devices, what's really concerning about them is that from the very beginning, they were always flavored. And you might think that flavor, we're trying to cover up the bad taste of the nicotine, which is true, but for years and years, we've done that in cigarettes by using menthol, which is actually a substance that provides some numbing of the throat and the neck. But for teens, because it was already so much more easier to inhale, instead of just using menthol, we started seeing lots of other flavors available. And they weren't flavors that were really targeted to adults. They were flavors that were targeted to kids and adolescents. So it's things like bubblegum and blue slushy and Fruit Loop, and my personal favorite, funnel cake. Why in the world would a tobacco company produce something that has a funnel cake flavor if it weren't to attract people who had never smoked before? And particularly with some of these flavors, people who were prone to like blue slushies and eat candy and Fruit Loops. And if that's not a child and adolescent population, then I don't know who is. So as you start talking to adolescents about their use of these devices, you're probably going to start hearing them talk about certain lingo that they use when they talk about using these devices. Probably the most common one is they may talk about juuling. So instead of saying I use an e-cigarette or I vape, they may say I juul, or I'm juuling with my friends. And essentially that's the same as vaping. It's an equivalent term. It may or may not refer to actually using a juul type device, but when vaping really exploded among adolescents, it was with the juuling devices. And so it's kind of hung around as just an equivalent term for vaping. But they may also talk about things like dripping or juicing. And so what happens when a kid is dripping or juicing is they're actually taking the liquid, and instead of putting it through the entire device, they're going to drop it directly onto the hot coil. And when they do that, they get a much higher nicotine concentration. And so it's essentially kind of the equivalent to huffing nicotine. You can get a really strong hit of nicotine really quickly by just dropping the liquid directly onto the coil. If they're talking about dabbing, they're going to be talking about THC in a vaping device and an e-cigarette device. So that's what that refers to. Kids may use the term of ghosting, which is something maybe you'd want to do if you were vaping in the back of the classroom, because you can take a puff of your e-cigarette and then hide the smoke in your airways. And because these devices typically produce a lot less smoke than traditional combustible cigarettes, you can hide it there for a while because it's not super toxic in terms of your sensation, and because it's a lot smaller volume. Patients may talk about getting nicked, which is essentially the high that they experience from nicotine. It's a euphoria that comes from having a high level of nicotine in their system. And they may also talk about being nick sick, which is having such a high level. It's essentially the bad side effects of nicotine that they get from having too much nicotine in their system. And they may get palpitations, vomiting, lightheadedness that come from nicotine overuse or from having too high of an immediate hit of nicotine. So as the general population became aware of the dramatic increase in vaping that we were seeing in adolescents, it not only became a problem for our medical community, it also became a problem in the general population. And so you see articles like this from USA Today and CNN and New York Magazine that really highlighted the fact that vaping has become an epidemic. And this is really, we started seeing this in 2017, 2018, and into 2019, that the risk of vaping, the targeting of vaping towards adolescents, and the number of adolescents that had started using vaping devices really was alarming, and that we were creating a new epidemic among our adolescents. And the reason they said that is because of this trend that you see on the chart here. So I want you to look at the orange line first, and this is from the National Youth Tobacco Survey, which is an annually delivered survey for middle and high school students. So if you look at the orange line and you go back to about 10 years ago, 2011, the combustible cigarette use in the last month was about 15.8%. And then we as pediatricians, and really even before this, we as pediatricians and the general population really became aware of the risk of smoking combustible cigarettes. We were talking a lot about the risk of long-term use and how bad it was for us. And over time, we really saw a dramatic decline in combustible cigarette use among adolescents. So we went from 15.8% to 5.8% in about 10 years, which was great. And we all jumped up and down and said, man, we're doing a great job, until you start looking at e-cigarette use. So what happened is that back in 2011, most of these devices hit the market between 2006 and 2010. So there's really a low uptake of vaping devices in 2011. And then slowly over time, the next couple of years, we saw a small increase. And then in 2013, we saw a dramatic increase, and that kind of leveled out for a few years. But then from 2017 to 2018 and on into 2019, we saw some of the most steeply rising rates of e-cigarette use that we'd ever seen. And what's really concerning about this is that we all jumped up and down when we got combustible cigarette use down so low. But if you compare this number to this number, we're now at much higher rates of vaping in adolescents than we ever were with combustible cigarettes 10 years ago. So one of the takeaways I'd love for you to think about with this particular concept is that from 2017 to 2018, when you go back and look at that graph, we went from 11% typical use for adolescents and 10th and 12th grade students to 21% typical use for 10th and 12th grade students in the last month. The reason that's important is because this is actually the largest year-over-year increase of any substance ever recorded in the youth risk behavior study. And we look at all the substances every year in this study for the last 50 or so years. And this is the single largest increase in a single year that we've ever noted. And what was even more concerning was that in 2019, we saw the second highest ever single year increase from 21% to almost 28% of past month vaping in these adolescents. So this was a trend that was terribly alarming to us as pediatrician and adolescent medicine specialists, and rightly so to the United States population as a whole. If you break it down by age, you still see this broken down. Of course, it's higher use in high schoolers than it is in middle schoolers, but even 1 in 10 eighth graders said that they've used a vaping device in the last 1 month. And so that's really concerning, again, because a lot of these devices are really targeted, the flavors are really targeted towards these younger students. So perhaps the good news, though, we'll see, is that when we went out to the National Youth Tobacco Survey in 2020, we did see a steady decline. So you may have seen some news about this, that maybe because of EVALI, maybe because of, we've done some good work to help prevent vaping or help to stop it, communicating the risk of it to our adolescent population. We saw a pretty good decline from 2019 to 2020. The caveat to this that I'm going to burst the bubble on a little bit is that this is pre-COVID data. So we sent out this study in the early spring, February and March, and then everybody said, oh, here's COVID, we got to wrap it up now. So this wrapped up in early March, which is earlier than it typically wraps up. So it's not quite the breadth of data that we usually have for this study. And before COVID, maybe we were really doing a good job educating our patients and helping them to find other coping mechanisms. But what I would propose is that, I don't know if you guys are seeing this, but my guess is that you're seeing what I'm seeing, that levels of anxiety in our adolescent population are through the roof. And the smart and ever-changing tobacco industry has decided to start marketing these vaping devices as anti-anxiety medication. And so my guess is that if we repeated this study today, we probably would have a lot less progress than this particular chart shows. We'll see with the 2021 data and what it reflects, but I do have some concerns that this may be more exciting on paper than it is in reality. So if you look at just this most recent data, about 1 in 5 high school students are currently using e-cigarettes, but almost half of them are using more days than they're not, greater than 20 days per month. And about 1 in 20 middle school students is currently using e-cigarettes, and about 20% are using them more days than not. What I think one particular statistic that's really interesting is that if you look at adult smokers, so those over 18, 7.6 million vapors are between the ages of 18 to 24 years old, and that doesn't include adolescents who are, getting these substances illegally, versus 5.8 million vapors who are greater than 24 years old. So the vast majority of vapors are going to be in that younger age population, in our adolescents and in our early adults. The other thing that I think, other couple of things that I think are important for you guys to know is that the most common devices previously were the pre-filled devices such as Juul. But with recent legislation and some limitations on who can create and sell and market flavored products, the use of Juul has actually declined because it's a refillable product or a pre-filled product. And what a lot of the market has changed to is this use of disposable e-cigarettes. And we'll talk a little bit about why that is, but it comes down to the fact that when the legislation rolled out to limit the flavors that were available in devices like Juul, it did not limit the flavors that were available in disposable e-cigarettes. So we have a huge loophole there, and the market and adolescents are certainly using that in their favor. In addition to vaping nicotine-containing products, about 14% of high schoolers also report vaping THC-containing products. And 8 of 10, as I've already alluded to, report using flavored e-cigarette products, which we'll look a little bit more at here. So you can see who's using which devices, and this is from the 2020 data, that there's a market increase in fruit in both the disposables and the pre-filled pods. Some are still using mint flavored products, some are using candy, desserts, or other sweet type of products, and some are using menthol containing products. And you can see the breakdown of each of those there. So what flavors are they choosing to use? Among high school students, about over 70% of them use fruit flavored products. The mint flavored products, which haven't been subject to the same legislation, are the mint and menthol are 55 and 37% respectively. And then the candy, dessert, or other sweets is about 36%. Among middle school students, the breakdown is similar in terms of fruit, but you'll see the second most popular types of products are candy, dessert, or other sweet type flavored products. And again, fruit, candy flavored e-cigarettes, those are not marketed towards previous smokers who are trying to quit, okay? If you've been smoking a pack of Camels every day since you were 20, you're not gonna switch to something that's bubblegum flavored. You're gonna smoke mint or menthol. And so these are not products that are marketed, despite what sometimes these companies want us to believe, they're not products that are marketed towards people who are trying to quit, adults who are trying to quit smoking combustible cigarettes. If you ask teens why they're vaping, a lot of them are just experimenting because they're teenagers and that's what they do. Some of them say they do like the taste or the flavor. Some of them are doing it very socially. Some of them are using it to relax or relieve tension. And this is data from 2019. And my guess is that would actually be markedly increased this year from the stories that I'm getting in my adolescent clinic. Some are doing it because they're bored, and then a few do identify that they wanted to quit cigarettes or because they know that they're addicted to e-cigarettes after using them. If I can give my adolescents one take-home point when they're in my clinic, it's that if you're smoking an e-cigarette, it absolutely contains nicotine. So in a study in 2018, this particular study found that about 60% of adolescents reported that they didn't know that their flavored e-cigarette devices actually contain nicotine. But in the United States, over 99% of all products contain nicotine. So the odds of them actually getting a product that doesn't contain nicotine is very, very low, even if they report they're only vaping it for the flavor. The other important component to know is that one pod of nicotine, such as in a Juul, can contain up to the equivalent of a pack of cigarettes. So if you're going through a pod every day, you are smoking the equivalent to 200 puffs of cigarettes or an entire pack. And our adolescents just don't realize that that's the case when they're going through pod after pod, smoking in the back of the class or in the bathroom or before their sport practice or before they go to bed at night. They don't realize the nicotine content that they're inhaling. So we're going to transition now to talk about why is this bad for them and what do our adolescents need to know. And this is a great slide from Indy Anderson that just kind of is a good kind of, this affects every system, is what we want our patients to walk away knowing, is that vaping does have severe consequences, and it's to all different parts of their bodies. So are there beneficial effects to vaping? Certainly there are beneficial effects to nicotine that a person can experience. So they may experience a boost in mood. They may experience that they have some appetite suppression, which for some of our patients, especially perhaps adolescent girls, that would be a benefit for them. Some of them, it increases their memory and alertness. So they may want to vape before they take a test or when they're trying to stay awake in class because they feel that effects. But the harmful nicotine effects greatly outweigh the beneficial effects. And a lot of those effects are actually, if they're paying attention to their bodies, they're effects that they can feel. So things like nausea and abdominal pain, they may have heart racing, they may get a headache, they may have some tremors or feel that balance problems. And those are all effects that I think are particularly important to discuss with your adolescents, because that's not like high blood pressure, which is something that feels kind of like this foreign concept to me that I don't know what that's doing to my body. I don't feel that, but these are all symptoms that they can experience, that if you can help them tie that to the fact that they're vaping, that's nicotine affecting their body, it may be more motivating for them to quit. And in terms of nicotine and what the patients are actually inhaling, I think it's important for them to know that they may be inhaling more nicotine than they're actually aware of. So if if a patient is interested enough to say, well, I get this much nicotine with every puff, well, that's really dependent on the power of the device. So some of these devices, you can actually turn up the power of the atomizer. And when you turn up the power, you're going to get higher concentrated levels of nicotine. And so it's really dependent on not only what pod you have or what disposable you're using. It's also dependent on what the power of your device is set at. So there are many variables that can increase the risk of nicotine exposure for our patients. I always tell my patients it can alter your brain because you have a brain that's still under development. There is a known association with an increased risk of transition to combustible cigarettes and other substances. And nicotine poisoning for other family members in the house has increased over 300% from 2012 to 2013. And that's really because there are pods laying around at home and a smaller kid gets a hold of it and ingests it. And so we've seen a huge increase in nicotine poisoning in younger children because of the effect of these pods laying around and them getting their hands on them. In addition to the nicotine effects, you also want to think about the vapor chemicals. So there's lung irritants, there's carcinogens, there's heavy metals. And of course, we've all heard about lithium battery explosions. And this is what a lithium battery explosion looks like when it happens on your face. So we've heard a lot about the ones that happen in your pocket or the ones that happen in your backpack or in a bag that's, that when you're traveling through the airport. But these can actually explode in your face and cause long-term skin damage that you may have scarring from for the rest of your life. So what is it exactly, though, since this is an academic talk, what is it exactly that nicotine is doing to our brains, and why does this make it such an addictive substance? Well, the bottom line is that it increases the stimulation of the reward center of our brain. So if you look at this very cartoon graphic here to the right, you see a few components of our brain, not in a brain diagram, but just kind of as parts here that are all communicating with each other. So of course, in adolescence, what we know is that the reward center of our brain, the nucleus accumbens, is really very sensitive to external pressure, right? Anything that happens is interpreted by by the deep centers of our brain, the emotional centers of our brain, the reward centers of our brain, with some developing but not yet fully developed autonomy from the prefrontal cortex, which is really where we make good executive decisions. And so when we get nicotine that hits our brain, what happens is that there's a dopamine release, and dopamine is a feel-good hormone. And when it's released into the nucleus accumbens, we see a sensation of reward. And again, the adolescent brain has a particularly sensitive reward center and a particularly underdeveloping and underdeveloped prefrontal cortex. So this is a marked effect in adolescents, even more effective than it is in an adult. So that's why the adolescent brain is even more sensitive to nicotine than the adult brain is. So despite what these patients may see, they may also experience a decreased attention as they use over time, because there's actually a decreased glutamate sensitivity over time that happens with repeat nicotine exposure. You can also see actual changes to the microscopic appearance in the brain. So you may get increased nicotine receptors. So it's an upregulation of the nicotine receptors that then increases GABAergic transmission, which in a developing brain, again, may potentially affect the long-term neuroplasticity of that brain, because it's still under development. And what you do now is going to affect the way your brain is finished growing in 5, 10, 15 years, depending on the age of the patient. There's also a dopamine transmission in the nucleus accumbens that's related to the prefrontal cortex as they interact with each other. Again, the reward center with the decision-making center that you can affect with that nicotine exposure that, again, may change the long-term plasticity of that patient's brain. So what does this mean on a very practical level? What you might want to share with your patients is that in adolescence, it's much more likely that you'll become dependent at a lower level of exposure. Again, that reward center is sensitive in the adolescent brain. And so when they get that hit and they experience that reward, it's much more likely that they're going to become addicted. They may become transition to combustible cigarette use. It may dispose them to drugs of other abuse. And so what we've seen, and if you break this down into adults who started with e-cigarettes or with nicotine, that they seem to have an increased sensitivity to cocaine, probably because some of those upregulation of those neurotransmitters. And so they actually may be more likely to use and then become addicted to cocaine. And this is still an interesting kind of area of development, is that we may see an increased risk of development of psychiatric disorders in kids who are using nicotine-containing devices. What about in our lungs? So there's certainly lots of different effects that you may see in terms of lung sequelae from vaping. There's a couple of nice studies that are listed here, but potentially you can see increased inflammatory markers on a microscopic level. You may see even increased inflammation on a macroscopic level. So if you're going to do a bronchoscopy on these patients, you may actually see the inflammation that the vaping devices are causing. There may be symptoms of bronchitis in patients who are using vaping devices, which, again, very often these are marketed towards, these are safer than combustible cigarettes. But if we're getting chronic bronchitis from the vaping devices, it doesn't seem to provide a whole lot of benefit, does it? There's known irritation, bronchial irritation from some of the substances in addition to nicotine that are in these flavors in particular. So things like benzaldehyde, which contributes to the cherry flavor, is a known bronchial irritant, and we're putting it into these devices and then inhaling it into our lungs. And there's even some substances that are contained in some of these flavors that have been implicated in conditions such as bronchiolitis obliterans. So there are some very severe lung effects that can happen from vaping, despite what we may have been led to believe by other sources. And of course, you've all heard of EVALI, which was all over the news before COVID, and is still happening to some degree, but has kind of been usurped by COVID-related illnesses, of course. But really, what I want you to know about EVALI is that it presents as a respiratory or a lung illness, such as with difficulty breathing, chest pain, even potentially hemoptysis. But these patients also have things like nausea and vomiting. They may even have fever and chills and fatigue. They often have headaches. And if a patient presents like that and they have a history of vaping in the last 90 days, this could be a potential presentation of EVALI. And so you want to get a chest x-ray, and what that's going to look like is a pulmonary infiltrate or even ground glass opacities. And of course, you want to rule out any other potential infectious etiologies. But with a negative infectious workup, this particular type of x-ray, and this history of vaping or dabbing, then this is a reasonable diagnosis to give these patients. We think that this is most likely related to vitamin E acetate, which is most commonly found in THC-containing products, but can be found in other types of products. But it works to disrupt the surfactant and then predispose these patients to these severe lung infections. Inflammatory complications. So what are you going to do when these patients walk into your office? So if they have these symptoms and they are known to use a vaping product, after you've ruled out infectious etiologies and you've gotten a pulse ox, you want to really see if the patient meets criteria for being an inpatient or an outpatient evaluation for follow-up. So if the patient is not having respiratory distress, if they have normal oxygen saturations, if they are otherwise healthy, then you can follow these patients closely as an outpatient. And so I have had one case of this that I followed as an outpatient, and he eventually did recover. But there, of course, we've all probably seen or heard of patients who've been admitted to the hospital with a inpatient who required inpatient management. And so if that is if that's the case for you, you want to make sure that they are having good supportive care, that we're providing them oxygen when they need oxygen, that if there's any concern for any comorbid infection, that we're treating the infection, but you can consider treating these patients with steroids, either as an inpatient or an outpatient. And of course, when they discharge, you want to make sure that they have good follow-up for complete resolution of their symptoms. What about vaping and COVID? Well, there's a really nice study actually from the last couple of months in the Journal of Adolescent Health, which looked at several thousand patients who had a history of vaping or use of e-cigarettes and their COVID risk. And what they found in this study was that they looked at patients who are using combustible cigarettes, e-cigarettes, or both, and then they looked at a few comorbid potential effects. And they found that adolescents who had ever used e-cigarettes, so any adolescent who had ever vaped, was 5 times more likely to contract COVID-19. So does vaping increase your risk of getting COVID? Yes, absolutely is the answer. And if a patient was using e-cigarettes and combustible cigarettes, they were 7 times more likely to contract COVID-19. So there's certainly evidence, and again, if we go back to the physiology of what these the substances in these devices are doing to our lungs, it makes sense that the disruption and inflammation that they're causing in our lungs is going to predispose these patients to contracting and having severe illness related to COVID-19. So there's also some behavioral components that may be also contributing to their risk of getting COVID-19, such as increased facial touching. So patients who are using vaping products are their hands are coming to their face a lot, and they're probably not washing their hands in between. And so that may be a contributor to this. And in adolescence, it's very common to share a device. So if you're going to go to the bathroom with your friend, you're both going to take a hit of your Juul. And so if one of you has COVID, certainly your risk there is much more increased. And that may be true over several adolescents over the course of the day, that they're all using a singular device. And of course, that's a good recipe for a COVID outbreak. There are some other more molecular theories that may predispose people to getting COVID-19 if they've been vapors. And one of those theories is that there's an association with changes in the ACE2 receptor in lung epithelial cells. So you can see in this cartoon here how those ACE2 receptors seem to facilitate some entry of COVID-19 actually into the epithelial cell where it can then replicate. Versus those who don't have a history of vaping, those ACE2 receptors are not upregulated, and therefore there's less likely intake of the COVID-19 virus into the cell. So how are you going to share this with your patients? There's actually some pretty good toolkits that have been made available by Stanford that are just really nice infographics about this study that can help educate your patients on their risk of COVID as it relates to their vaping use. So what are we doing about this on kind of a more macro level from vaping legislation? So we'll go through a few things that have happened both nationally and here in the state of Tennessee in the last few years to give you an idea of how can you advocate for your patients in terms of legislation to improve their outcomes, perhaps prevent adolescents from being able to use vaping devices in the future. So the history that you need to know about is that in 2009, there was a Family Smoking Prevention and Tobacco Control Act, which just essentially said that e-cigarettes may not be safe. So remember, e-cigarettes came to the market in about 2006. So this was kind of very early evidence. that we think they're probably not good for you, but we're still waiting on all of the literature review to know exactly what the outcomes are related to these. And then we waited a while. So between 2019 and 2016, there was a lot of conversation, but not a whole lot of legislation that passed. And then in 2016, this quote unquote deeming rule passed, and which for the first time gave the FDA oversight into e-cigarettes. And so for the first time, they actually had the ability to regulate e-cigarettes in the United States. And what they decided was that if a new product was going to be introduced into the United States in terms of an e-cigarette product, it had to be approved by the FDA. And they made a rule that you must be 18 or older to purchase e-cigarettes. So that was just a few years ago that passed on the national level. However, a lot of the components of the deeming rule actually didn't become enforceable until the very recent future. Initially, it was supposed to be 2018, but then by some other things that were going on, and probably by some petitioning from these companies that were making these products, it was actually delayed from 2018. So in 2019, the Food, Drug, and Cosmetics Act changed the legal age of purpose from 18 to 21 on the national level. And then in January of 2020, so just earlier this year, the FDA actually made a statement that prioritized enforcing a flavor ban in marketing to teenagers. And in September 9th of 2020, the enforcement of that actually began from what we talked about in the deeming rule earlier, that if a product had not had an application submitted to the FDA, that it had to be pulled. And so this is really where we saw the transition for a lot of our products, especially Juul type products that had a huge flavor-based market, start pulling their flavors. And so Juul actually, quote unquote, voluntarily pulled all of their flavors. And left just with mint and menthol on the market. But again, there was this huge loophole in these legislative acts that allowed for combustible cigarettes to continue marketing and making flavor-based devices. And so what's really happened is it seems that most of our users who are using things like Juul that had refillable pods have now actually transitioned probably to combustible cigarettes or combustible e-cigarettes. So what about in Tennessee? What does this look like? So do you have to have a license to sell e-cigarettes? You don't. Is there, in our state, there's not necessarily a non-sales tax that's placed on e-cigarettes. The liquid containers do have to be child resistant, which again, when you think about those early slides when we were talking about the risk of nicotine ingestion by younger kids in the house, the packaging of that made it really more difficult, and we've seen some decline in that since this has gone into effect. Are there restrictions in place for youth access? And the answer is that you're supposed to be 18 to buy these products. Unfortunately, there's lots of ways around that, including you can buy Juul and Juul pods or puff bars or whatever you like on eBay. You can get them delivered to your house. Even I went on a website even this week where you just have to click and say that you're over 18 and like enter a birthday, and then that counts as you being able to get devices delivered to your house. So there's lots of ways around the youth access that certainly our youth are going to be easily maneuver. And then what about smoke-free restrictions? And the nice part, Tennessee has really done a nice job in recent years to really become a smoke-free friendly state, so that if there are places where kids are going to be, like museums, healthcare facilities, children's parks and playgrounds, those kind of things, then those should be tobacco and e-cigarette free areas. So what's going to happen hopefully soon for our Tennessee legislation is that what we hope is that we're going to move our state minimum tobacco sale age, and that will apply to e-cigarettes too, from 18 to 21. And that should happen at the beginning of 2021. What do we want to happen? In September of this year, there was a joint letter from the AAP and several others who asked the FDA to adopt guidelines for how they're going to approve the devices that do submit a request for approval for sales in the United States. And what we've asked is that they don't permit any flavored tobacco products or nicotine devices that could be for sale in the United States, because they are obviously such a target towards a younger demographic. We ask that products not lead to increased rates of nicotine use, and really that's the burden of the e-cigarette company to prove that they don't actually lead to combustible cigarette use, and they've had trouble proving that, especially in the younger age population. And we want them to prove that it has less risk than a traditional tobacco product. And again, there's lots of conversations about that, but is it actually true remains to be seen. So what about if you go to clinic this afternoon and you see a kid who tells you that they're vaping? How are we going to deal with that? And this is the last piece of this presentation that I hope to leave you with some really practical things that you can take with you and maybe use even later today. So what does the AP have to say about this? Well, they recommend that we screen everybody for e-cigarette use. And what I always encourage my residents to do is to ask specifically about vaping. So if you're in the habit of asking about, well, do you smoke or do you drink or do you have sex? For patients who are vaping and you ask about smoking, they're probably not going to say yes. They don't think that e-cigarette use is the same as combustible cigarette use. And so they're probably going to say, oh no, I don't smoke. But if you ask them specifically, do you vape or use e-cigarette devices? Very often the answer to that question is yes. And so we should be asking specifically about vaping every time we're asking those other questions of our adolescents. We also want to talk about, where is it okay for people in the house to use e-cigarettes? So in the same way that cigarettes are not okay inside a home, we shouldn't be using e-cigarettes inside a home because of the, one, we want our adults to set good examples for our adolescents, but we also want any of the byproduct of these devices to not be affecting our adolescents in terms of the risks for their inhalation of nicotine byproduct or some of these chemical byproducts that could be coexisting as perhaps even adults in the home use them. And we also don't want to recommend that any adolescent use e-cigarettes as a tobacco dependence treatment product. If you look at the literature, there is some evidence in the adult literature for heavy smokers that it could be beneficial for traditional cigarette cessation to use e-cigarettes. That is not true in the adolescent population, and there's nothing to support that claim. So these are never going to be devices in an adolescent population that's going to help them quit. So if that's a argument or a question that your patient has, you can definitively tell them that that's not been shown to be true in adolescents. How can we screen for these? What questions are we going to ask? So again, if you just ask something as simple as, in the past year, how many times have you used a vaping device? That's all you have to ask. And you can then look at, I like this from Sharon Levy and her group that talk about, if they're no use, what do you do? If they've used once or twice, if they've got monthly or weekly use, then we're really talking about, is this patient someone who may have an addiction or a dependence on this substance? And so we need to know what to do with that. But very often the question I get from providers who may not be accustomed to asking these questions is, but if I ask about that, isn't that going to encourage them to try it or make them feel like they're, weird because they've never tried a vaping device? And this is how I answer that question, is that if I have a patient who says, oh no, I've never tried vaping, I'm not interested in that. Well, then I can provide positive reinforcement there. I can say, choosing not to use a vaping product is a great decision for you. I'm so glad that that's what you're choosing for yourself. And there are a lot of other people. Actually, most kids your age aren't using vaping devices either. And that's true from the youth risk behavior study. If we go back to the very early slides of this presentation, we saw that, maybe about 40% of older adolescents are using vaping devices. So there are going to be a lot of people who aren't using vaping devices. And so you want to make sure that they understand that it doesn't make them the Lone Ranger if they're choosing to abstain from these devices. But what if they are using, but they're only using, once every now and then? And I really like the idea, there's some tools that I think we can borrow from motivational interviewing that give us some good framework for talking to adolescents about why it's in their best interest not to partake in these activities. And so I like using phrases like, oh, for your health, I really think it's best if you stop vaping, that's not great for you. And what you should know about it is that it impairs the normal development of teenage brains. And so it could affect like the long-term development of your brain if you continue to use that. It also could give you serious lung infections and make you more at risk for COVID-19. So just in a couple of sentences, I can give them some really good advice. It's pertinent for them. It talks about their brains. It talks about their lungs. It talks about COVID-19. I'm giving them the information that they need to make a good decision to quit vaping. There's also this concept of, okay, so what if, maybe they don't really care about their lungs. They're 15 and who cares if I live to be 30? How can we plug into those adolescents? Well, I think finding something that they already value and figuring out how adolescents, how that may impact the things that they value, such as sports, is a really good approach to helping them see the value in quitting their vaping. And so you may say something like, oh man, you're a really good student, but did you know that vaping marijuana can really change your motivation? And that I've seen kids who vape marijuana and then they have trouble going to school, or they have trouble making the grades that they made before. And that might be a reason to consider quitting. Or to say something like, what I know about vaping is that it actually causes inflammation in your lungs. And if you're vaping and then trying to run track, man, you might not be as fast because your lungs aren't able to process the oxygen as quickly. And so you can really key into some of the things that they already value so that you can build on that to help encourage them towards stopping their use. And of course, if you have time, it's always a great tool to use motivational interviewing. If you've been trained in that and you've got some time and some experience in that, this is a great way to just further help adolescents identify for themselves what are the reasons that they might want to quit, and how can I help them and support them in doing that. More traditional approaches for kids who may already have dependents, who are using weekly or using monthly or using every day. You may use the 5 A's, which is a long-standing, proven effective counseling for people who may have nicotine dependence. And so you can ask about use, which we've talked about. You can advise to quit, which we've talked about. And then you can ask them if they're ready to quit. And if they say no, you say, okay, well, I'm here when you're ready. But if they are ready to quit, then you can talk about what are the ways that I can help you quit. Do you have such severe nicotine dependence? So we may need to talk about medication to help you with your withdrawals. Or is it something you just need to come see me in a couple of weeks so I can cheer you on, or I can help continue to encourage you to stay away from your vaping devices. There's also the 2 A's and an R, which is ask, assist, and refer. So you're going to ask everybody if they smoke or vape, and then you're going to assist them in their quit attempt, as we just talked about, and then you're going to refer to cessation services. So there's lots of those that are available. I think probably the most relevant one for teenagers is this last one from the Truth Initiative. You can actually text Ditch Jewel to 88709 and start a conversation and get lots of resources for how you can quit vaping if you're ready to do that. If you're going to assist them and they're ready to quit, you want to set a quit date within a couple of weeks. You want to get rid of everything that you could potentially use, because in the moment of, I'm really stressed, I really need to vape right now to calm me down or to help me concentrate, you don't want to have access to those devices, because if they're still hidden under your bed, you're going to go get them, or you're going to go use them in a moment of weakness. And I always encourage my adolescents to tell family or to tell friends that they're trying to quit, so that they have support. They've got somebody they can text or call when they really want to use their substance. And then they have some support in the moment to help them be successful. And then you want to anticipate any challenges. So I'd go ahead and talk about, you have a test next week. What are you going to do? I know you've been using your vaping to calm me down before tests. What are you going to do instead? Or maybe even it's I know finals are next week, so maybe next week's not the time to quit. What if you try over Christmas break? And so helping them identify the best time to quit may also be something that you can help anticipate the challenge of. And then, of course, there are pharmacological supports that you can use, including nicotine replacement. So this is an off-label use, so I'm going to just preempt it with that. But what we know is in an older adolescence, there can be some benefits to this. So things like a patch, which is a 20 milligram patch, is essentially equivalent of a pod a day. And you can get these in lower doses too if you need them. There's also some people that would tell you could cut them. Again, that's going to be a less consistent dosing, but you certainly could, if you needed to, cut one in half or cut one in fourths for lower dosing for that consistent nicotine release. I really like lozenges or gum, which we can prescribe or they can use over the counter. So the next time you feel the need, so I even recently had a patient who was vaping. She was only vaping like a few times a day, but she was finding it really difficult to quit. And so I prescribed for her some lozenges so that the next time she really got that urge to vape, she could pop a lozenge and get her, decrease that nicotine urge so that she was able to be successful at quitting. There is in adults, there's some well-documented evidence that Wellbutrin is helpful, and if it's combined with counseling in terms of cessation of smoking cessation. And Chantix also is indicated in adults, but could be used in older adolescents. You just need to monitor for suicidality and vivid dreams. So what are the additional resources that you have at your fingertips if you have your phone available? The Truth Initiative is a really nice adolescent-friendly website that can give lots of information about both combustible e-cigarette use as well as vaping use. Smoke Free Teen is a governmental site that helps teens learn how to quit if they're smoking or vaping. For you as a provider, the AAP actually provides a really nice e-cigarette curriculum if you want to learn more about the things that we've talked about today. The link is provided there for you. And there actually are some really nice billing and coding benefits that you can use in terms of your counseling and in terms of documenting your e-cigarette use that your patients are using, or that you're providing counseling for your visits, so that some of this time that you're going to use to counsel these patients is reimbursable. So I think we got just a couple minutes left. If there are any questions, I'll be glad to take them now. And I really appreciate your time and attention. I appreciate your willingness to address this issue with your teenage patients, and hopefully to curb this epidemic for future generations.
Oh, wasn't unmuted. Thank you, Dr. Bowden, for an amazing talk. We do have a few minutes for questions, if there are any questions.
Hi, I have a question. This is David Wood.
Yeah.
Hi, Dr. Bowden. Thank you so much for a wonderful talk. We use the screener, the craft screener that has the nicotine question on it.
Yes.
How sensitive do you feel that is, or in your experience, or are there any studies that have shown whether it really picks up? With rates of 25 to 40% of use, we're certainly not getting anywhere near that rate of positive.
Yeah, I think the newest edition of the craft, if that's what you guys are using, that includes some vaping use, is beneficial. I'll tell you what, my colleagues who are doing a lot of substance abuse work is saying that they see a lot higher rates if we're actually doing those on paper or in electronic component. So if you can do it on an iPad or you can give it to the patient, I think the main benefit of that is that it really promotes some confidentiality among our adolescents, so that they don't feel like, they've got to answer this question in front of their parent. It just seems, if you compare in-person interviews for vaping versus responding positively on a questionnaire or on an iPad assessment, that really seems to be the best way to accurately assess that. Of course, our rates in clinic are never equivalent to what we see on the youth risk behavior study, because those are totally anonymous and they're done in school. And so, they're not going to be followed up on in terms of your mom's not in the next room or in the waiting room. And so, we consistently get higher rates on the youth risk behavior study. But I think anything we can do to promote confidentiality in the patient and our patients, and with especially in our, resident clinics, or when you're seeing adolescents in the community, really helps to get better answers to that. And again, I think sometimes it's just a matter of asking the right questions, right? Sometimes it's not even enough to say, do you ever use nicotine containing products? You have to say, so when was the last time you vaped? And they'll say, oh, I've never vaped, but it kind of normalizes it in a way that helps them to feel like, oh, I'm not going to, have to go to detention if I tell my doctor that I vaped. So I think those are some tools that you can use to get perhaps more accurate answers with your patient population.
Thank you very much.
Yeah.
And I agree that confidentiality piece, and we do ours on paper. We hand them the piece of paper kind of folded over. And our adolescent docs, Dr. Wood and Dr. Dodd, do make it a point to try and see especially the older teenagers by themselves if possible.
Right.
And if a parent comes with them, we try and do them alone first and then kind of bring
Right.
the parent back. So
yeah, I have some, I think it would be particularly interesting to see what our rates are, and because I haven't seen this study done, is if you compared getting that information on an iPad or an electronic device versus, or even like letting them scan a QR code and do it on their own phone versus doing it on a paper, because I still think my adolescents feel like there's some risk to doing it on a piece of paper. But if it and again, there's so many barriers to that, like integration with the electronic medical record and those kind of things that make that a very difficult potential. But I do think that may be the future of what we do with adolescents. And so I would be very interested to see how our rates compare if we were able to go 100% electronic and confidential with our patients. So maybe that's the future. And if you guys ever want to partner on something like that, I would love to make that happen. So let me know.
No, that's a great idea. This is Dave Wood again. I love the idea of the QR code and letting them scan it, and then they could do it on their phone. Even if the parent's sitting in the room,
Right.
We really struggle with the process of keeping it absolutely confidential. It's
Right.
really
it is. Our medical system is not built for adolescents, and so there's lots of difficulties there. But I am actually working on some QR related stuff that I'm hoping to distribute through the Tennessee AAP, just in terms of vaping information that will be available to adolescents and to parents that we can distribute to our to kind of every pediatrician in Tennessee if they're interested, that will provide a direct link to some of these resources like the Truth Initiative that I've talked about, to help give more direct access to our adolescents if they're ready to quit but aren't maybe ready to tell us or their parents that they're ready.
Thank you.
Mm-hmm.
we'll look forward to that, and would love any of the residents on the call to try and do more for us in terms of getting resources together for our clinic. But again, we really do appreciate you, Dr. Bowden, and look forward to working more together in the future.
Absolutely. Great talking to you guys. Thank you for having me. And I feel free to distribute. I don't think I included it on the presentation, but feel free to distribute my email if anybody has other questions.
Wonderful. Thank you so much.
All right. Have a great one.
Bye-bye.
Bye-bye.